Hello, my name is Simrit Kaur, and I'm a PharmD candidate in the class of 2022. Today I will be going over the medication hydroxychloroquine, also known as Plaquenil. I will give a basic overview of the medication. It is used as an anti-malarial. In regards to direction, for malaria, take 1 dose of medication by mouth per week starting at least 1 week before traveling to the area where malaria transmission occurs. Take 1 dose per week while there and for 4 consecutive weeks after leaving. For rheumatoid arthritis, the direction are take 2 to 3 tablets by mouth as a single dose or 2 divided doses. For lupus, take 1 tablet by mouth or 2 tablets in 2 divided doses. Common side effects associated with Plaquenil are nausea. Serious side effects associated with Plaquenil include QT interval prolongation, ventricular arrhythmias, hypoglycemia, anemia, agranulocytosis, thrombocytopenia, hemolysis, disorder of the muscle, extrapyramidal disease, retinal disorder, hearing loss, and angioedema. Hydroxychloroquine falls under the class of a disease-modifying antirheumatic drug, also known as a DMARD. Its indication for FDA label is lupus erythematosus, malaria, malaria prophylaxis, and rheumatoid arthritis. It previously was given the green light for emergency use authorization for COVID-19. However, the FDA has removed authorization as it has shown to be ineffective. Pros and cons of hydroxychloroquine. The pros of Plaquenil include a decrease in number of disease flares, a decrease in damage from disease over time. Over time, it is also shown to reduce swelling and joint stiffness, and its effective ability for prophylaxis and treatment of malaria. Cons include the serious adverse effects associated with the medication, and it must be taken as directed for full effect. Mechanism of action. The exact mechanism by which hydroxychloroquine exhibits activity against parasite is not known. Hydroxychloroquine is a weak base and may exert its effect by concentrating in the acid vesicles of the parasite and by inhibiting polymerization of heme. It can also inhibit certain enzymes by its interaction with DNA. The mechanisms underlying the anti-inflammatory and immunomodulatory effect of hydroxychloroquine for rheumatoid arthritis and systemic lupus are unknown. In rheumatoid arthritis, it is believed to act as a mild immunosuppressant, inhibiting the production of rheumatoid factor and acute phase reactants. It also accumulates in white blood cells, stabilizing lysosomal membranes and inhibiting the activity of many enzymes, including collagenase and the proteases that cause cartilage breakdown. Dosage and formulation. Hydroxychloroquine, or Plaquenil, comes in an oral 200 mg tablet. Dose recommendations for prophylaxis of malaria is take 400 mg once weekly on the same day each week, starting 2 weeks prior to traveling, and then continue on the same day each week while in the area and 4 weeks after leaving the area. For treatment of malaria, the initial dose is 800 mg by mouth for 1 dose, and then 400 mg at 6, 24, and 48 hours after the initial dose. For dose recommendations for lupus erythematosus, Take 200 to 400 milligrams by mouth once daily or in divided doses. For rheumatoid arthritis, there's an initial dose of 400 to 600 milligrams by mouth once daily or in divided doses. And then for maintenance, there's a range of 200 to 400 milligrams once daily or in divided doses. Dose adjustment. For patients with renal impairment, reduction in dosage may be required. For patients with hepatic impairment, reduction in dosage may be required. For geriatric, elderly folk, use with caution, start with a low dose. Warnings and precautions. Patients with hypersensitivity to 4-aminoquinolone compounds should not use this medication. Precautions for patients who have previous QT prolongation, ventricular arrhythmia, and torsade de pointes. Serious rash including Stevens-Johnson syndrome, severe exacerbations of psoriasis may occur. Myelosuppression may occur including aplastic anemia, agranulocytosis, leukopenia, or thrombocytopenia. Severe and potentially life-threatening hypoglycemia with a loss of consciousness may occur. Myopathy, neuropathy, irreversible retinal damage may be reported, and any signs of suicidal behavior. Monitoring parameters. A complete blood panel should be periodically done during prolonged therapy. Renal function test should be done during treatment in elderly or renal dysfunction patients. Baseline ophthalmology examination should be done in all patients prior to long-term use and should be repeated annually or when there is clinical signs and symptoms of change. For malaria, termination of acute malarial attack or absence of or reduced malarial parasite count on blood smears should be monitored. For systemic lupus and rheumatoid arthritis, resolution of signs and symptoms, improved range of motion, decreased early morning stiffness, and painful swollen joints should be monitored. Clinical signs and symptoms of cardiomyopathy, including use of appropriate diagnostic tools, ECG, should be done. Muscle strength and deep tendon reflexes periodically should be done during prolonged therapy. Here are the references used in this presentation. Thank you for watching and have a great day.